Hello everybody, in this video lecture we will cover anatomy of the peripheral nervous system. I will use PowerPoint to help myself. So here's the PowerPoint that I'm using, PNS. Let's go ahead and begin. Let me pick up my pointer. So peripheral nervous system includes all neural structure outside the brain and spinal cord that includes sensory receptor, peripheral nerves, and associated ganglia and motor endings. So on this picture in yellow, you see central nervous system, and in the orange, we see peripheral nerves, spinal nerves, and here cranial nerves. And ganglia, ganglia is a cluster of cell bodies of neuron. And I will show it to you in a minute. And motor ending, of course, the ones that supply your muscles or your glands. So peripheral nervous system is divided into sensory or efferent division, motor or efferent division. So sensory information moves through the efferent division towards CNS, and information from CNS or commands or instructions from CNS moves through the motor or efferent division to the effector organs, muscles, or glands. Efferent division is made of somatic and autonomic nervous systems. Somatic innervates your skeletal muscles, and you can control those muscles, and autonomic ANS innervates smooth muscle, cardiac muscle, and glands, and they are under involuntary control. Autonomic nervous system is divided into sympathetic and parasympathetic. So sympathetic is called fight or flight division. So it is active when you exercising or you under stress. Parasympathetic is called rest and digest, and it's active when you resting, when you digesting food for energy. Here you're using energy. Structure of a nerve. Nerve is an organ, and it's a bundle of myelinated and unmyelinated peripheral axons enclosed by connective tissue. So here's axon covered by myelin sheath, then surrounding by endoneurium, that's connective tissue. Then this axon make fascicles, and fascicles are surrounding by perineurium, and then several fascicles and blood vessels surrounded or enclosed by epineurium, and that make a structure of a nerve. So endoneurium is loose connective tissue that encloses axons and their myelin sheath. Perineurium is coarse connective tissue that bundles fibers into fascicles, and epineurium is tough fibrous sheath around a nerve. Most nerves are mixed. That means they have both sensory fibers and motor fibers. Some are pure sensory or efferent, and some are pure motor or efferent. However, those are rare, and only cranial nerves can be pure sensory or pure motor. Mixed nerve will include somatic efferent, somatic efferent fibers, and visceral efferent and visceral efferent. So efferent are sensory. So inside a nerve, you have sensation coming from your skin, for example, that you understand this information, and fibers that bring information from your internal organs, and some of this information you might not understand, like your blood pressure or sugar level. Efferent means motor. Somatic efferent innervates skeletal muscle, and visceral efferent innervates smooth muscle, cardiac muscle, and glands. Everything that is innervated by somatic efferent fibers, you can control, and you cannot control your organs that are innervated by visceral efferent fibers. Like you cannot control your heart muscle, you cannot control smooth muscle of your stomach, and you cannot control your glands. You cannot control, for example, your sweat glands. You cannot tell yourself, yeah, it's hot, let me start sweating, right? You cannot do it. So Peripheral nerves also classified as cranial or spinal. And it depends on where they connect to the central nervous system. Cranial nerves, they are connected to the brain. Spinal nerves, they connected to the spinal cord. Now, ganglia contains cell bodies associated with nerves. So we already talked about this. So this part over here, this is a spinal nerve. And nerve has two roots, ventral and dorsal root. And inside this dorsal root, we have cell bodies. So this is called ganglia, dorsal root ganglia. And this is where cell body of the sensory neurons are located. We do have another ganglia, autonomic ganglia. It's located in a special structure called sympathetic trunk. And we will not cover this ganglia in this lecture. So over here, spinal nerve, all spinal nerves are mixed. You can see it has both sensory fibers and motor fibers, and two types of sensory fibers, somatic and visceral, and two types of motor fibers, somatic and autonomic. But when it's split into two roots, ventral root and dorsal root, those roots is a sensory, dorsal root is sensory root, and ventral is motor. And here's the ganglion. See this blue and green neurons? Those are sensory neurons. Sensory neurons are unipolar, so the cell bodies are located in the ganglia. And these lines represent axons. There are 12 pairs of cranial nerves, and most are mixed. Each nerve, cranial nerve, is identified by number 1 through 12. So this is Roman numerals, and they have a name. So this is called mnemonic, and mnemonic help you to put these cranial nerves in order. So mnemonic says, or to take a family vacation, go Vegas after hours. So each letter is the first letter of corresponding cranial nerve. So let's look at those nerves. So over here, here's the number 1, right? And this is olfactory, well, it's called olfactory tract, but it used to be called olfactory nerve. So this is called olfactory bulb, and then olfactory tract. So number 1. Number 2 are optic nerves. So here's optic nerve and here's optic nerve, and they go all the way to the retina. This is called optic chiasma. This is where fibers cross. So this is oculomotor, or number 3. So let's start with number first. So 1, 2, 3, 4, 5. And then we go 6, 7 have like 2 branches, 7, 8, 9, 10, 11, and then we go over here, 12. Right, so here we have 12 cranial nerves. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, then facial, vestibular cochlea, glossopharyngeal, vagus, accessory, and hypoglossal. Right, so numbers and names. So number 1, the olfactory nerves. Actually, those are olfactory nerves. They are located inside your nasal cavities. Right? And then they attach to olfactory bulb, and an olfactory bulb became olfactory tract. And this information now about smell carried to your temporal lobe. So it arises from olfactory receptor cells of nasal cavity, and this one is pure sensory, only olfactory, right? Sense of smell, that's the function. Optic nerve. Optic nerve arises from retina. So here's the retina of an eye, and here are the optic nerves. Then they cross at optic chiasma, and they move further, right, finally to the occipital lobe through the optic tracts. So retina, optic nerve, optic chiasma, optic tract, and this is called optic radiation to the visual cortex that located into occipital lobe. This one is also pure sensory, only visual function in vision. Oculomotor nerve. This nerve is motor nerve. So fibers extend from the midbrain, right? So here's midbrain. So now we're moving to the periphery, and it's innervate most of the eye muscles, extrinsic eye muscles that move your eyeball. So it functions in raising eyeball, directing eyeball, constricting the iris, and controlling lens shape. So it's also move over here, and it can constrict the iris. Iris is this dark spot inside your eye, and behind we have lenses, so it also controls the shape of lens. So this one is motor, so it goes from the midbrain, ventral part of the midbrain, to the muscles. Trochlear nerve. Trochlear nerve number 4, also motor nerve, and it's also innervate eye muscle. It just innervate one muscle. It's called superior oblique, right? This one, superior oblique. So it goes from the dorsal part of the midbrain to the superior oblique, and it's also move an eyeball. Trigeminal nerve is a big one. This is number 5, and it's called trigeminal because it has 3 big branches, and we call these branches V1, V2, and V3. Ophthalmic over here, V1, maxillary, and mandibular branch. And they actually sensory branches. They bring this all sensation, right, to your brain. So if somebody touches you here or here or here, right, or your dentist work on your teeth and it's painful, this trigeminal nerve is responsible for sending this pain to your brain. However, this V3, it also has some motor fibers for mastication, so you can chew your food. Abducens nerve, that's a motor nerve as well. So it's arise from the inferior pons, and it's innervate lateral rectus, so only one muscle of the eye movement. So most of the muscles of eye movement are innervated by oculomotor, and we have trochlear nerve, innervate the superior oblique, and we have these abducens that innervate the lateral rectus. And because it's innervate muscle of eye movement, it's responsible for eye movement. Facial. Facial is number 7, right? So it's a, it has motor fibers. It does have some sensory fibers from your tongue. So it's bring taste from anterior 2/3 of the tongue. This is sensory division. And we have 5 major motor divisions, right over here: temporal, zygomatic, buccal, mandibular, and cervical. And this nerve innervate all your facial muscles and allow you to do facial expression. So it moves your muscles of your face, right? So movement of your face muscles is facial nerve, 7. Sensation from your face, 5, trigeminal. Right, so over here you can see this is our motor branches, right? And it does have some other functions. So it's innervate lacrimal gland. It's also innervate salivary glands, sublingual and submandibular. And it brings sensation from the tongue, from 2/3 of the tongue. Vestibular cochlear nerve. This one mostly sensory nerve. So it's bring information from your cochlea for hearing, and this will be a cochlear branch, and from vestibular apparatus, and this is vestibular branch, and then they fuse together forming vestibular cochlear nerve, right? And it attaches to the central nervous system just below the pons. Glossopharyngeal nerve, number 9. This is the only cranial nerve that contains all 4 types of wires: somatic sensory, visceral sensory, somatic motor, autonomic motor, and it's bring the taste from the tongue, information from baroreceptors about blood pressure, and chemoreceptors about oxygen and carbon dioxide concentration in your blood plasma. And it has a motor function. It's a motor function for swallowing and motor function for salivary gland secretion. So here you can see that number 9, right? Glossopharyngeal. Glossa means tongue, and pharyngeal means pharynx, or your voice box. So here's the sensory information from the tongue, right? And also here's sensory information from the baro and chemoreceptors. So they're located here inside the carotid artery, right where the common carotid is divided into internal and external carotid, right? So right here we have baro and chemoreceptors. So that's a sensation. What is my blood pressure? So this is the nerve that telling your brain about your blood pressure. What is oxygen level in my blood? Here's the nerves that tell your brain what is your oxygen. And this is visceral sensation because it doesn't reach your consciousness. And this is sensory, how this food tastes, right? This one, somatic sensory, because it will reach your consciousness. And here's the motor branches. One to the pharynx, so allow you to swallow, and one to the parotid gland. So this parotid gland starts secreting saliva. Vagus nerve, number 10. The only cranial nerve that extends beyond head and neck region. This is the nerve that brings sensory information from all your viscera. So all this sensation from your liver, stomach, small, large intestine, kidneys, right? Spleen, lungs, heart, all the sensory information goes through vagus to your brain. Brain stem specifically, right? Because it never reaches your consciousness. And it's also had the motor neurons, autonomic motor neurons that regulates function of these organs as well. So it's receive information from these organs and it's regulates its function. This is called major parasympathetic nerve. So it's active when you're relaxed. Accessory 11. Accessory formed by part of the ventral rootlets. So it's in the cervical region, right? So it kind of, well, now they believe it's not even cranial, it's a spinal nerve. So it has this, they call it spinal accessory. So it starts in the cervical region and then it moving up, right, through the foramen magnum, and then it's turned back and exited. So that's why first they thought it's a cranial nerve, but it's actually a spinal nerve. That's why it's called spinal accessory. This one innervates only 2 muscles, sternocleidomastoid muscle and trapezius. 12 is hypoglossal nerve. This one innervates your tongue, but this is responsible for movement of the tongue. Remember 7 and 9, they bring sensory information from your tongue. That was cranial nerve number 7, facial, and number 9, glossopharyngeal. but hypoglossal responsible for tongue movement. And of course, then it's help you in swallowing and speech. Now, spinal nerves. 31 pairs of mixed spinal nerves, and they name according to the point of issue from the spinal cord. So 8 cervical, C1, C2, C3, so from C1 to C8. And their names are nerve number C1, C2, 12 thoracic, T1 through T12, 5 lumbar, L1, L5, 5 sacral, S1, S5, and 1 coccygeal, C0 or CO. So here you can see that cervical, they originate from cervical region, thoracic from thoracic, and so on. Each spinal nerve connects to the spinal cord via 2 roots. Ventral root contain sensory or efferent, contains motor. Oh, it's a ventral root, sorry. Dorsal root contains sensory. Ventral root contains, of course, motor, right? So let's look at the picture here, and then we get back. So again, this is the spinal nerve that is mixed nerve. Then we have dorsal root, and this is where we have sensory fibers. And we have ventral root, and this is we have motor fibers. So remember, those are one-way streets. Sensation goes behind you, and motor in front, right? So that's a ventral, that's a dorsal. So that's what it is. Ventral roots contains motor or efferent fibers from the ventral horn, motor neurons, and fibers innervate skeletal muscles. And dorsal root contains sensory or efferent fibers from neurons in the dorsal root ganglia. So dorsal and ventral root, they unite to form spinal nerves, which then emerge from the vertebral column via intervertebral foramina. Right, so here vertebra, and between 2 adjacent vertebrae, there is an opening or hole. It's called intervertebral foramina, right? So here's the one, here's another one. So here's 2 roots, dorsal and ventral, dorsal for sensory or efferent, ventral for motor or efferent, and then they unite and exit through this intervertebral foramina and became spinal nerve. Spinal nerve is actually very short, like this, because then it's branches. It branches into ventral ramus and dorsal ramus. Ramus means branch. So it has anterior or ventral branch and posterior or dorsal branch, or ventral ramus and dorsal ramus. So each spinal nerve branches into mixed rami. Dorsal ramus is smaller and ventral is larger. All ventral rami except T2, T12, so not in your thoracic region, but all other ventral rami, they form networks that called plexuses. So we have cervical plexus, brachial plexus, lumbar plexus, and sacral plexus. Okay, cervical plexuses formed by ventral rami C1, C4, and they innervate pretty much your neck, skin and muscle of the neck, and then ear, back of the head, and shoulders. And one important nerve that formed from cervical plexus is phrenic nerve. A phrenic nerve innervates diaphragm, and it's received fibers from C3, C5. So look what I mean. So here's the blue part over here. This is the spinal nerve. And then those spinal nerves, they branch into rami. So all this structure are ventral rami. Oh, hold on, it show already ventral rami. So they do not show us the nerve. Okay, let's then go back. So you see this little part over here? This is a spinal nerve. So spinal nerve where two roots, dorsal and ventral roots, unite. So this is the spinal nerve. So they skip this part. And then spinal nerve is divided into dorsal ramus and ventral ramus. So they started with this ventral ramus, that's shown in blue, right? So here. So that's already ventral ramus. And then it's forming this network called plexus. This is specifically cervical plexus. And then this is the phrenic nerve. So you can see, well, phrenic nerve comes from what spinal nerve? Is it from C5 or C4 or C3? It actually comes from all three. So axons from spinal nerve C3, axons from spinal nerve C4 and C5, they all kind of mixed over here to produce, to make this phrenic nerve that innervates diaphragm. Another is brachial plexus. Brachial plexus formed by C5, C8, and T1. And nerves that rise from brachial plexus, they innervate upper limb. Okay, so here again we have, so now they say it's ventral rami, right? So this is our ventral rami, and we're not going into details over here. However, sometimes students are required to remember the structure of brachial plexus. But from C4 to T1, all this axon again form this network called brachial plexus, and then we have peripheral nerves. And those are the major one and important ones that innervate your arm: muscular cutaneous, radial, median, and ulnar. So if you look over here, right, so here's the radial nerve shown in green, and this will be on the posterior side. That's why they showed in a different color. Now this is muscular cutaneous, right? Then this nerve on the radial side, right, actually gonna be medial, median, because we already have this radial on the posterior side. So this will be median, and this one is ulnar on the ulnar side. So this bone is radius, this is ulnar. Right, so this is how they innervate your arm. So muscular cutaneous innervates biceps brachii, brachialis, and skin of lateral forearm. Median innervates the skin, most flexors and pronators. Ulnar innervates the flexor carpi ulnaris, digitorum profundus, and radial innervate everything on the posterior side. So all the extensor muscles. Well, we didn't cover muscles yet, right? So right now, just remember the name of the nerves, and when it comes to the muscular system, then we will get back to this and we will learn what nerves innervate what muscles. But those are major nerves of brachial plexus. Now we do not have any plexuses in the thoracic region, so we move straight to lumbar. Lumbar from L1 to L4, and they innervate the thigh and abdominal wall. Two major nerves are femoral nerve, innervate your quadriceps, and obturator nerve, innervate adductor muscles. So, so over here, that's our lumbar plexus. And here we have this big femoral nerve, right? This one. And then it branches into several nerves, one of them saphenous, very long one. But this is the femoral, so it's innervate your quadriceps. Quadriceps are located in this area. And this is obturator, because it passes through this obturator foramen, and it's innervate medial muscles of your thigh, right? And those muscles are actually adduct your hip, right? So bring it together. So these medial muscles are innervated by obturator nerve, and quadriceps, this muscle on the anterior side, are innervated by femoral. And sacral plexus, from L4 to S4, so we're moving down. And this serves the posterior part of the thigh and leg. So it serves buttock, lower limb, pelvic structure, perineum, and one major nerve is sciatic nerve. That's the longest and thickest nerve of the body. Innervate hamstring muscle, adductor magnus, most muscle of the leg and foot, and is composed of two nerves, tibial and common fibular. So let's look over here. Okay, so here's the sacral plexus. And okay, so here we have all these nerve fibers that form sciatic nerve. So that's a big sciatic nerve. And then sciatic nerve, right, moves down. And when it reaches this popliteal region over here, right, it's divided into common fibular and tibial. And it's innervate all the muscles of the leg, right? So sacral plexus. And innervation of the skin. So what we talk about was innervation of your muscles mostly, but your skin is divided into these different regions that are called dermatome. Dermatome is the area of skin innervated by the cutaneous branches of a single spinal nerve. So if you have C2, it's innervate this skin area. C3 innervates this skin area, C4, C5, and so on, right? So all spinal nerves except C1 participate in dermatome. So the back of your head innervated by C2. Okay, very quickly, I want to tell you kind of like, I don't know if it makes sense or not, but look, when we talk about plexuses and peripheral nerves over here, right, that innervate your muscle. So if I tell you, well, let's say this is tibial nerve, right? Tibial nerve arises from what spinal nerve? Because remember, we have 31 pairs of spinal nerves. So if you have, for example, let's say if you lost movement of your leg, not because the tibial nerve is damaged, but because the part of the spine is damaged. So you can damage it at pretty much any region. You can damage at L4, L5, S1, S2, right? You can damage, you can have like damage over here or over here or over there, and it all will affect your tibial nerve. So tibial nerve and all these nerves that originate from plexuses, they have like crazy amount of fibers, and we are never sure what those fibers are coming from, right? When we're talking about dermatomes, that's more precise. So if the patient lost sensation in this area, we know that C2 is damaged, right? When the patient lost sensation in this area, we know L2 is damaged. That's how, you know, clinical significance of the dermatomes. Okay, well, anyway, this was our last slide. I'm reminding you that we were covering peripheral nervous system, and we talk a lot about nerves, cranial nerves, and spinal nerves. Thank you for watching, and I hope it was helpful.